Assalamualaikum warahmatullahi wabarakatuh, and greetings from me, Nurfaika Shakira binti Razha, and my partner Nurfahana binti Shahrul Nizam. On this delightful day, we will presenting our research on the topic of the impact of work from home policy towards job satisfaction among Uitm Seremban 3 academic staff. First and foremost, I will explain on the research background. Work from home policy is now widely known due to the crisis of pandemic COVID-19. Although it is not a new thing, it had been widely enforced due to the unfortunate circumstances. Since it is a quite popular topic to be discussed, we had decided to choose to do a research on these related topics. The main keyword that had been used is work from home, which carried the description of a concept where employees executing their professional job from home rather than working at the office. Other terms that are synonyms to the phrases of work from home is working remotely. Next, I will be presenting on the problem statement. According to JobStreet, 67% of Malaysia company had instructed employees to work from home. It is understandable the reasons behind all the others, but we must remember that work from home is not relevant to all employees. For some, it may be the opposite of a dreamy experience. Work from home can somehow be draining and consuming to some of the employees. This is proven by the survey done by the Martech Group on 1,214 employees, which resulted in significant decline of mental health across the industry, seniority level, and also demographics, which then triggers us to study more on the impact of work from home policy.
My name is Nurfahana binti Shahrul Nizam, and I will continue on the research question and research objective. The first research question for this study is what are the impact of work from home policy to the academic staff of Uitm Seremban 3? The second research question is do academic staff of Uitm Seremban 3 satisfy with their job? The third research question is does the impact of work from home policy has any effect on employees' job satisfaction? With these three research questions, we managed to come out with three research objectives. The first objective is to identify the impact of work from home policy towards the mental health, work-life balance, and responsibility of academic staff at Uitm Seremban 3. This objective is to know whether the three elements are the impact of work from home policy. And the second research objective is to examine the level of satisfaction of Uitm Seremban 3 academic staff towards their current job. This objective is to know whether they satisfied with their job or not. And the last objective is to investigate whether the job satisfaction is being affected by the implementation of work from home policy. This objective is to know which impact of work from home policy that gives effect to the job satisfaction. As you can see, the impact of work from home policy stands as the independent variable, while the job satisfaction is the dependent variable. According to Reynolds 2017, work from home is a concept where employees do their work assigned from their home without need to commute to their workplace. The implementation of the work from home policy in Malaysia due to COVID-19 give impact towards employees in various dimensions, such as mental health. Fuser Poly 2020 mentioned that mental health relates with daily activities that includes the work from home. Other than that, impact towards the work-life balance as the work from home policy may affect the employees' balanced lifestyle as they need to balance between their work and personal life. Last, impact towards the responsibility as there are various of contacts needed to render during the work from home. while the dependent variable of job satisfaction defined as the feeling of content, self-motivated and satisfied when completing the job. It happened when the employees feel that they achieved the good working environment and they manage to grab the opportunities for the advancement. Each research objective have its own hypothesis development. For the objective to identify the impact of work from home policy towards responsibility, work-life balance and mental health of academic staff at Uitm Seremban 3, the hypothesis H1, there is an impact on mental health, work-life balance and responsibility caused by the work from home policy. For the objective to examine the level of satisfaction of Uitm Seremban 3 academic staff towards their current job, the hypothesis developed is H2, academic staff of Uitm Seremban 3 is satisfied with their job. For the last objective, to investigate whether the job satisfaction is being affected by the implementation of the policy, the hypothesis developed includes all elements of independent variable, which are H3, the mental health has a significant impact on job satisfaction among the academic staff of Uitm Seremban 3. H4, work-life balance, has significant impact on job satisfaction among the academic staff of Uitm Seremban 3, and H5, responsibility, has significant impact on the job satisfaction among the academic staff of Uitm Seremban 3.
As for the methodology, we decided to go for quantitative approach. We then narrow down the targeted respondent to those who fulfill two main criteria, that is, an academic staff of your Uitm Seremban 3 Negeri Sembilan and also those who experience work from home policy. For the sample size, we decided to consider green ideas, which is the rule of thumb, and decided to go 100 people as our respondent. We also decided to use purposive sampling technique, which is one of the convenient sampling procedure. It is a very straightforward technique with an earlier setup of criteria for the respondent. As for the measurement, we distribute a closed-end questionnaire and is measured by a Likert scales. Since our data is from primary sources, we made a questionnaire which consists of 3 sections and that covers 3 dimensions of independent variables and 2 dimensions of dependent variables. For the first time, it is distributed to the non-targeted respondent for us to conduct the pilot test. After getting the result, there are some changes that need to be done in order to finalize the questionnaire. The finalized questionnaire is then redistributed, but this time to our targeted respondent. And last but not least, we run data analysis with the help of SPSS. The tests that we run are mean analysis and Pearson correlation.
The questionnaire being distributed to 100 respondents. For findings, there are 6 questions under the demographic profile. For gender, can see that female with 69 respondents while male with 31 respondents. In terms of age, the highest number of respondents came from the range 36 to 45 years old with 42 respondents, followed by 28 respondents from 35 years old and above, and 25 respondents came from the age 46 to 55 years old, and the least age range is 55 years old and above with 5 number of respondents. For home area, 60 respondents located in urban, while suburban with 39 respondents and only 1 respondent located in rural area. For marital status, majority of respondents are married with 82 respondents, meanwhile 17 respondents are single and 1 respondent divorced. There are 70 respondents that have children under the age of 18 years old that live together, while the other 30 respondents doesn't have. The highest range number of child is between 0 until 1 child with 41 respondents, followed by 40 respondents that have 2 until 3 number of children. Next, 12 respondents have 4 until 5 children, and the remaining 7 respondents have more than 6 children. in their house. In this part, we record all the findings that we gain in order to decide with the hypothesis developed. For the objective, to identify the impact of work from home policy towards responsibility, work-life balance and mental health of academic staff at Uitm Seremban 3, the analysis used is mean analysis. The result shows that mental health with a value of 3.9000, work-life balance 4.4000 and responsibility 4.5763. All the values are more than 2.5, thus H1 is accepted. For the objective to examine the level of satisfaction of Uitm Seremban 3 academic staff towards their current job, the analysis also used the mean analysis and the value recorded is 4.1388. Thus, H2 is also accepted. For the objective to investigate whether the job satisfaction is being affected by the implementation of work from home policy, the analysis used is Pearson correlation in order to determine that there are positive relationship between the variables. The p-value should less than 0.05. For the variable mental health, the p-value is 0.00, so the H3 is accepted. Work-life balance with the p-value 0.171, so it's more than 0.05, thus H4 is rejected. Lastly, for variables responsibility, the p-value recorded is 0.000, thus the H5 is accepted.
There are three research implications that had been identified by us. The first one is health promotion and prevention of negative coping behavior. Government and organization needs to promote a better and healthy way in coping the work stress related to assure job satisfaction among the employees. As for example, the World Health Organization who had established an illustrated guide on stress management called Doing What Matters in the Stress of Time. It can be easily accessed by going through their website. The second one is establishing self-discipline and close monitoring. This is where employers and employees need to have a win-win agreement related to their job. As an employer, they need to understand that the performance when working from home and when working at the office is different. And for the employees, they need to understand their limits and discipline on when to engage off from their work. The third one is the skills, staff training and also development. Working from home may require an advanced and unfamiliar use of technologies. Thus, it is crucial for the employees to undergo a training. Online training can be done and arranged with the involvement of an expert. A peer-to-peer learning also can be done and considered as a way in developing a skills. In completing the research, we do face some limitation. The first one is the limited sample. Other than having difficulties in determining the exact number of population, we also have difficulties in contacting the targeted respondent. We use several different approaches such as WhatsApp and official email, but only 100 of them are willing to respond and participate in the research. The next limitation is limited model, as we only focus on 3 dimensions of the impact and also 2 dimensions on job satisfaction. Lastly, quantitative study is undeniably time-consuming. It takes a long time waiting for response from our targeted respondent. A specific number of respondents is needed to ensure the validity of our research. So, we have to wait for quite some time before proceeding to another section. As a conclusion, many things have changed due to the pandemic of COVID-19, including our routine of going to office. A work-from-home policy has been implemented as a substitution in order to ensure the stability of our economy. However, in implementing the policy, we must remember not to overlook the impact to an employee's job satisfaction. Although work from home has its own advantage, it also has their own disadvantage.